Hi everybody, Dr. K back with you for contact tracer training. This is Unit 1, Part 3. And in this video, we're going to focus on high risk situations. A shared living environment, congregate housing setting where every individual family has a private living quarters, but they share a common dining room, recreational, other. A nursing home comes into effect, retirement homes, and we've heard horror stories about COVID spreads in nursing homes, uh, and perhaps in college dormitories. Uh, and then there's the high risk subpopulations, uh, people that are more at risk for the illness. Unfortunately, this impacts on poor and minorities uh, at far more higher frequencies and percentages than it does to people who are living in uh, middle class or upper class communities. Uh, Things that increase your risk for infection and severe disease are dense environments. Uh, you think about apartment complexes, high-rise buildings, again, nursing homes, college dormitories, in situations where it's difficult to contact trace, to identify. Maybe people are afraid of immigration. Perhaps people don't speak the same language. Perhaps uh, there's hostility toward government workers. Places that are difficult to isolate or or quarantine. Places where there's higher risk. Families that have people with pre-existing conditions. These are indeed risk factors at this time. Certainly, we need to be concerned with dense environments, large crowds of people. Uh, People who are within 6 feet of each other for prolonged periods of time. Concerts, ball games, church services, they all can lead to super spreading events. There was a bike rally in Sturgis, uh, South Dakota that led to several cases. Campaign rallies can put people at risk. We saw a super spreader event taking place one after another, basically during these this election year. So large crowds of people, like at conferences. Now many conferences have gone virtual as a result of COVID for health reasons. We've seen problems on mass transit. Subways have had to be disinfected. We've seen large church gatherings leading to community spread. We've seen demonstrations in the streets that can lead to people contact becoming exposed to COVID. Indoor bars are real problems. Indoor restaurants that are crowded, gymnasiums, uh, and of course schools. Because not only do we have students in schools, younger kids who may not be quite as risk, but all of the older people that work in schools are certainly at risk. These are, these are dense contact environments that we need to deal with and be concerned with as contact tracers. Uh, and it might be difficult to find out who the contacts were. People may not know who they contacted with, or at a huge event, you have so many different contacts, and you only know a few of those people. It's difficult. That's why it's really important during this pandemic to limit the size of the crowds that gather together. Uh, and so, an example of a problem could be like at a homeless shelter. Maybe people don't know each other. Contacts come and go. Difficulty to locate or to test all the contacts that came in came across the homeless community. We have uh, facilities that are different, that are difficult to isolate or quarantine. Like a family living in a house where one or two people have COVID, or a group of of adults with developmental disabilities might be more at risk. Oftentimes, they come with other health issues. There may be a problem in the nursing home or in the hospitals where a difficulty getting masks and gloves and protective equipment. Healthcare workers have been severely impacted by this COVID due to the service of trying to help others. And there may be social pressures, immigration issues, legal issues, skepticism with the government type issues that make it difficult to encourage and enforce isolation and quarantine. Not everyone is willing to cooperate. And another problem might be like a care facility where residents may not be able, with special needs, may not understand or be proficient at the concepts of hygiene, social distancing, and it's maybe harder to get them to wear the protective gear that they need to wear. Another issue that could have impact the health of a dense facility. And again, people with pre-existing conditions, heart disease, respiratory, per immune, obesity, they're at real high risk if they were to contact COVID. These are the people, along with the elderly, that we really need to protect. And if you're in a hospital or an assisted living facility, we need to reduce the possibility that they get exposed to people with that condition. Unfortunately, we've made some mistakes. We've learned from our mistakes, and I think and nursing homes are better protected than they were at the beginning of this pandemic. And remember that people living in these dead facilities may get exposed and re-exposed and re-exposed over the course of time. So it's quite, the bigger the exposure, the larger the exposure, the larger the community spread, the harder it is to do contact tracing effectively. That's why you've noticed that some Asian nations have been able to nip this problem in the bud early to eliminate big pandemics, and we haven't been able to date. So contact tracers have to help identify these high-risk situations in the communities that they're tracing in. Where are these places that are most at risk? Perhaps they're looking at the contacts of people on a flight, maybe people who went to a movie, a conference, a certain class has been exposed. They need to identify these high-risk situations and do as effective job as they can to identify all the contacts, and perhaps maybe looking at people, having people share their cell phone records, some of the texting they've done to help them remember who they've been in contact with. And remember that oftentimes we need to follow up on cases and contacts. It's not one call is not enough. We need to make sure that when it's about time for them to come out of isolation or quarantine, we follow up and make sure that they're ready indeed for that. And whenever we have a real complicated problem that we need help with, we have to escalate our case, our tracing case, to a supervisor. We need to get help and not let the problem fester. Well, you've been exposed to quite a bit now regarding the field of contact tracing, and I'm Dr. K. We get further into it. I'll be back with you again in Unit 2. Bye.